Niggas in my grill tryna phase me.
Hello guys, it's me, Fredjan Calantes. Welcome to my vlog. So before we start, kindly subscribe and click the notification bell so that you will notify all the videos that I will post in here YouTube. So for today's video, I will show you some injuries that may happen when you're performing cheer dance. And of course, I will show you my dance routine in cheer dance. So, what are you waiting for? Let's start!
You know I'm gonna get you, yeah. Whatever it takes to get there. You know I won't drop you like everybody else does. Forget about your friends, they don't care where we go. If we do, we're lost in a crowd of people. I've been looking for you forever, baby. We go together, baby. We go. In this crazy world of choices, I've only got a few. Either you're coming with me, or I'm coming with you. 'Cause I finally found you. I finally found you. You never have to worry if what I say is true. 'Cause I've been looking for you. When I saw you, I knew that I finally found you. I finally found you. This guy you are, you know I'm gonna get. This guy you are, you know I'm gonna.
Okay, let's go to the step. So first step that I did is this. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. The next step is this. Just like this, close hand, then jump. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. The next step is this. This one. Oh, just like that. So, count up to 8. Count up and count down up to 8. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Then the next step is this. 1, 2, 3, 4. Repeat it 4 times. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Then 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Then the next step is marching. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. Then the chorus is rolling. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Repeat it 4 times. 1, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. The last step is 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. In cheer dancing, there's a lot of injuries that may happen when performing. We can't avoid because sometimes we felt nervous when we are performing on stage. That's why we commit a lot of mistakes and injuries as well. So, first injuries or sometimes common injuries that may happen in cheer dancing, whether you are practicing or you're performing on the stage, is the ankle sprains. So ankle sprains are the most common traumatic injury in dancers. So it means that this ankle sprains is very common na. Most dancers will experience their first sprain by age 13. This injury is caused by any movement that forces the ankle outside of the normal range of motion, resulting in an overstretching or in tears to the ligaments of the ankle. So, these are the common mistakes that may happen or injuries that may happen when we are performing. Even you're not cheer dancer you can also perform in many dance, such as sometimes in ballroom dancing, dance sport, and many more. So prevention, 4-way ankle exercises, hip strengthening, treatment, rise joint protection, early mobility, physical therapy. And next, common injuries that may happen during cheer dancing or in a cheer dancing is Achilles tendonitis. Achilles tendonitis is an inflammation of the tendon in the back of the ankle that connects the prime mover for pointing to your foot. As the Achilles is active during relief and pointing the foot, this overuse injury is quite common in dancers. It means quite common in dancers, especially those utilizing improper technique or participating in excessive training. So, prevention, stretching your Achilles with your foot in parallel, quadriceps, hip, core strengthening to decrease force absorption at the ankle. The treatment is physical therapy focused on correct training technique. Modalities to decrease inflammation, calf stretching, and soft tissue to calf and surround musculature. Number 3, pain, trigger toe, or flexor hallucis longus tenosynovitis. Trigger toe is another overuse injury that causes inflammation and damage to muscle that is active during pointing the big toe. So the prevention is good from with your leads and not crunching your toes to force a point, rolling out the arc of your foot with a ball, but not to the point of pain. So, treatment, physical therapy, correct technique modalities to decrease inflammation, stretching, and massage. Surgery to release tendon from surrounding tissue if symptoms do not resolve. The next one is ankle impingement. Ankle impingement is the pinching of tissue at ankle at either the front or the back of the ankle. So prevention, stretching your Achilles and stretching but not forcing your foot. Treatment, PT to improve ankle mechanics and technique. Surgery, if there is one bone spur or extra bone between heel and back of tibia. The next is snapping hip. Snapping hip syndrome often starts as an annoying snapping sound in the front of the hip with developed or batements. Prevention, foam rolling your hip, flexor, quadriceps, IT band, and glutes as well as stretching your glutes. Treatment, PT with core strengthening, pelvic stabilization, modification of class, and rehearsal work into symptoms results. The other one is the hip impingement. Hip impingement can be caused by many different factors, from arthritis, labral tear, stress fracture, muscle strain, snapping hip syndrome, sacroiliac joint dysfunction, to piriformis syndrome. It is extremely common in dancers due to the imbalance between the amount of external rotation turnout. They have compared the amount of internal rotation or turn in. So the treatment, foam rolling your hip flexor, quadriceps, IT band, and glutes as well as strengthening your glutes. Treatment, PT with stretching hip core strengthening, pelvic stabilization dance, modification and rehearsal may result in surgical intervention as needed. The other one is patellofemoral pain syndrome, also known as jumper's knee, result from the kneecap tracting incorrectly due to the muscle imbalance, tight hamstring, and calves coupled with weak quads. The placement of reflective force on the patella, like through performing jumps or flies without proper form, puts a dancer at increased risk. So the prevention, core and hip strengthening, foam rolling hip flexor, quadriceps, IT band, and glutes. Treatment, physical therapy with focus on core and hip strengthening, IT band stretching, and re-education of dysfunctional movement patterns. That's all for today. Thanks for watching. I hope you enjoy a lot and learn a lot in this video. See you next time. Bye!